Level 1. Caffeine. 90% of adults use it every day. It's in your coffee, your tea, your soda, your chocolate. It's the most consumed drug on the planet, the caffeine. This is what it does. Your brain produces a chemical called adenosine. The more it builds up, the more tired you feel. But caffeine blocks it, slips into the same receptors and shuts them down. You feel awake, alert, focused, but your brain adapts. It grows more receptors, but more receptors means you need more caffeine, not to feel good, just to feel normal. That's dependence. In 2012, the World Health Organization officially recognized caffeine addiction as a clinical disorder. It changes your brain. Physically, you stop drinking it, withdrawal hits within 12 hours. Headaches, fatigue, irritability, nausea. It lasts up to 9 days. One man in a study admitted he took the bus to a store at 2 in the morning just for soda because he couldn't sleep without it. That's 90% of adults every single day, and most of them have no idea they're hooked. Social media. You check your phone, nothing new. You check again, still nothing. 5 minutes later, you check again. You're not waiting for anything. You just can't stop. Social media is designed like a slot machine with infinite scroll and unpredictable rewards. Every like, every comment, every notification triggers a hit of dopamine, the same chemical released by cocaine. A Harvard study found that talking about yourself on social media activates the same reward centers as addictive drugs. In real life, people talk about themselves 30 to 40% of the time. On social media, 80%. And it changes your brain, physically. A 2016 study found that heavy Facebook users had reduced brain volume, the same pattern seen in cocaine addicts. The platforms know this. They built it this way. Notifications, likes, infinite feeds. All engineered to keep you scrolling. 5 to 10% of Americans meet the criteria for social media addiction. 210 million people worldwide, and most of them don't think they have a problem. They just check their phone one more time. Level 2. Nicotine. Nicotine reaches your brain in 20 seconds, faster than if you injected it into your veins. It floods your system with dopamine. You feel calm, alert, focused, and your brain remembers. 32% of first-time users become dependent. Not after months, not after weeks. Some people get hooked after 1 or 2 cigarettes. Nicotine is as addictive as heroin and cocaine. The World Health Organization says so. The science is clear. It rewires your brain, creates new receptors. The more you smoke, the more receptors you grow. The more receptors you have, the more nicotine you need. That's addiction. There are 1.2 billion tobacco users in the world. 8 million die every year. Smokers live 10 years less on average, and half of them will die from smoking-related diseases. 70% of smokers say they want to quit. 40% try every year, but only 3% succeed. Just 3%. The withdrawal hits hard. Anxiety, irritability, insomnia, depression. Your brain screams for nicotine, and most people give in. 80% of smokers started before they turned 18. The younger you start, the harder it is to stop because your brain is still developing, and nicotine shapes it permanently. Alcohol. Alcohol is the third most consumed drink on Earth, after water and after tea. 283 million people have an alcohol use disorder. 3.3 million die every year. That's 5.9% of all human deaths. Not drug deaths, all deaths. In 2023, the World Health Organization made it official. No level of alcohol consumption is safe. Not 1 glass. 0. Your brain adapts to alcohol in 3 stages. First, the high. Your reward system floods with dopamine. Then tolerance kicks in. You need more to feel the same. Finally, withdrawal. And here's where alcohol gets dangerous. Unlike most drugs, alcohol withdrawal can kill you. Your nervous system, used to being suppressed, fires uncontrollably. Seizures, hallucinations, heart failure. It's called delirium tremens, and it gets worse each time. The kindling effect. Every withdrawal is more severe than the last, and your brain remembers. Between ages 20 and 39, 1 in 4 deaths is caused by alcohol. It cuts 10 years off your life expectancy. 1 in 10 dementia cases? Alcohol. Yet only 5% of people with alcohol use disorder are ever diagnosed, and it's legal everywhere. Level 3. Prescription pills. They come in orange bottles with your name on them, prescribed by a doctor. In 2020, over 16 million Americans misused prescription drugs. The trap is simple. Opioid painkillers, benzodiazepines for anxiety, and stimulants for focus. They work on the same brain systems as heroin, alcohol, and cocaine. Same receptors, same reward pathways, just different packaging. Between 21 and 29% of people prescribed opioids for chronic pain will misuse them, and 80% of heroin users started with prescription pills. Your doctor writes a script, your body builds tolerance, and like that, you need more to feel the same. Then you need it just to feel normal. That's called physical dependence. In 2020 alone, prescription opioids killed 16,500 Americans. Benzodiazepines killed another 12,300. Elvis Presley, Prince, Michael Jackson, they all died from prescription medications. The cruelest part? Stopping can be dangerous. Benzodiazepine withdrawal can cause seizures. Opioid withdrawal feels like dying, so people keep taking them, not to get high, but to survive. From 2006 to 2016, stimulant prescriptions in America nearly doubled. The supply increased. So did the addicts. Gambling. No needle, no pill, no smoke, just a bet. In 2013, the American Psychiatric Association made it official. Gambling is an addiction. Same brain pathways as cocaine. Same reward system as heroin. 6 million Americans are addicted to gambling. Most will never seek help. 90% never do. Here's what makes it lethal. Variable ratio reinforcement. You win sometimes, you lose more, but your brain can't predict when the next win comes, so it keeps you playing. Slot machines, loot boxes, sports bets, all engineered on the same principle. 2/3 of teenagers have gambled in the past year, many through video games, loot boxes, digital slot machines disguised as entertainment. 50 million people bet $16 billion on the Super Bowl. One platform reported 50,000 bets per minute. 96% of gambling addicts have another psychiatric disorder, like depression, anxiety, or substance abuse. In one Australian hospital, 17% of suicidal patients were problem gamblers. There's no FDA-approved medication, no antidote, just the next bet. Level 4. Cocaine. The dopamine system in your brain is older than dinosaurs, older than trees. It evolved hundreds of millions of years ago. Cocaine hijacks it in seconds. The drug blocks your brain's ability to reabsorb dopamine, so it floods and euphoria hits, a pleasure beyond anything natural. In laboratory experiments, animals given a choice between cocaine and food chose cocaine. They kept choosing it until they starved to death. In 2021, over 24,000 Americans died from cocaine overdoses. More than half of those deaths also involved fentanyl. Dealers are cutting cocaine with synthetic opioids now. You might not even know what you're taking. Here's what happens inside your skull. After repeated use, your brain produces a protein called delta phosphide. It accumulates for 6 to 8 weeks. It changes which genes turn on and off, and it causes your neurons to physically grow new branches, structural changes that may be permanent. Your brain literally rewires itself around the drug. 15% of users become addicted within 10 years. Women are 3.3 times more likely to develop dependence. People who start at age 12 or 13 are 4 times more likely than those who start at 18. There's no FDA-approved medication for cocaine addiction. No substitute, no antidote, just a brain that remembers. Benzodiazepines, Valium, Xanax, Ativan, Klonopin. 75 million prescriptions a year in America alone. They come from your doctor, for anxiety, for sleep, or for panic attacks. That's what the prescription doesn't tell you. The Royal College of Psychiatrists found that 40% of people who take benzodiazepines for longer than 6 weeks become addicted. Some studies show 23% addicted within 3 months. The drugs work by enhancing GABA, the same neurotransmitter system as alcohol. Same mechanism, same cross-tolerance. Doctors use benzodiazepines to treat alcohol withdrawal because the brain can't tell the difference. Tolerance develops in days. For sleep effects, 3 to 14 days. For anxiety, 4 months. After that, the drug stops working, but your brain needs it anyway, and withdrawal, it can kill you. Seizures, hallucinations, psychosis. Your nervous system becomes more excitable every time. 10% of elderly patients referred to memory clinics have drug-induced cognitive problems. The most common cause? Benzodiazepines. Emergency department visits increased 139%. 3/4 of benzodiazepine deaths also involve opioids. Prescribed, legal, doctor approved. Level 5. Heroin. 80% of heroin users started with prescription pills. They didn't plan this. Nobody plans this. Heroin is a semi-synthetic opioid made from morphine. When injected, it reaches your brain in 7 to 8 seconds. The rush lasts less than a minute. But your brain will chase that minute for years. Regular use leads to addiction in 2 to 3 weeks. Your body needs the drug every 6 to 12 hours just to avoid withdrawal. Miss a dose, and it begins. Muscle pain, vomiting, cold flashes, and diarrhea. Users describe it as the worst flu of your life, multiplied by 10. 75% of heroin users have a co-occurring mental health condition, like depression, ADHD, or bipolar disorder. They weren't chasing euphoria. They were escaping pain. Brain scans show long-term heroin use physically alters how your brain works. Recovery can take months, sometimes years. Sometimes the changes are permanent. There's an antidote for overdose, the naloxone, but it only works if someone's there to give it. Meth. It takes 50 days from first use to first craving, 60 days to regular use, 85 days to compulsive use. 3 months. That's all it takes to lose control. Methamphetamine was first synthesized in Japan in 1893. Soldiers in World War II used it to stay awake for days. Now it's cooked in home labs from household ingredients. When you smoke or inject meth, the rush hits in seconds. Euphoria, invincibility, endless energy, but the high fades fast. So users binge for days without sleep, without food. What they call a run. Then comes the crash, and then the psychosis. 36% of users experience hallucinations, paranoia, delusions. Some believe bugs are crawling under their skin. Between 2011 and 2016, meth overdose deaths tripled. In 2021, almost 33,000 people died. Meth is now present in 63% of opioid deaths. There is no FDA-approved medication for treatment. 61% of those who try rehab relapse within 12 months. Without treatment, only 30% achieve 5-year remission. Meth doesn't just flood your brain with dopamine. It damages the neurons that produce it, and the changes can be permanent. Level 6. Fentanyl. This level has only one entry, because it doesn't need another. 2 milligrams. That's all it takes. The weight of a few grains of salt can stop your breathing forever. Fentanyl is 50 to 100 times more potent than morphine, 30 to 50 times stronger than heroin. It was synthesized in 1960 as a surgical painkiller. Now it's the deadliest drug in American history. In 2021, over 70,000 people died from synthetic opioids, primarily fentanyl. That's more than 150 people every single day. Since 2018, fentanyl has caused more overdose deaths than any other drug. It now accounts for 70 to 80% of all drug fatalities. What makes it terrifying is that you can't see it. You can't smell it. You can't taste it. Drug traffickers mix fentanyl into heroin, cocaine, meth, even press it into counterfeit pills designed to look like Xanax or Adderall. 42% of tested pills contain a lethal dose. 1 kilogram can kill 500,000 people. Fentanyl can paralyze your chest muscles before you even lose consciousness. You don't choose fentanyl. Fentanyl chooses you.